Welcome, everyone. Today, we're going to explore the fascinating world of pharmacodynamics, which is the study of the biochemical and physiological effects of drugs on the body. As we delve into this topic, I encourage you to ask questions and engage with the material. Let's start with the concept of drug action. When a drug interacts with cells at the site of action, it produces a physiological or biochemical response, which is known as the drug effect. The majority of drugs produce their effects by interacting with a specific target biomolecule, which is usually a protein. These proteins can be grouped into four major categories: enzymes, ion channels, transporters, and receptors. Starting with enzymes. These are the proteins that speed up chemical reactions in our body. Some drugs can stimulate an enzyme, which means they increase its activity, making it work faster. For example, pyridoxine, a form of vitamin B6, acts as a cofactor, boosting the activity of certain enzymes. On the flip side, drugs can also inhibit enzymes, slowing them down or stopping them completely. There's what we call nonspecific inhibition, where drugs just mess with the enzyme's shape and stop it from working, like how heavy metals or strong acids can shut down any enzyme they touch. Then, there's specific inhibition, where the drug targets a specific enzyme, either blocking it or competing with its natural substrate, like how certain drugs block the action of cholinesterase. Next, let's talk about ion channels. These are gateways in the cell membrane that allow ions, like sodium, potassium, or calcium, to flow in and out of cells. Some drugs block these channels directly, while others affect them by interacting with receptors that control the channels. For example, quinine blocks sodium channels in heart cells, while other drugs like amiodarone block potassium channels, helping to manage abnormal heart rhythms. Now we move on to transporters. These are the proteins that move substances, like nutrients or neurotransmitters, across cell membranes. Some drugs work by hijacking these transporters, blocking them to stop the movement of certain chemicals. A good example is amphetamine, which blocks the dopamine transporter, increasing dopamine levels in the brain and causing stimulant effects. And lastly, we have receptors, probably the most well-known targets of drug action. Receptors are like docking stations on cells, and drugs can either activate them or block them. When a drug activates a receptor, it mimics the body's natural signaling molecules, producing a similar effect. This is what we call an agonist, like how nicotine mimics acetylcholine in the brain. On the other hand, an antagonist blocks the receptor, preventing the natural signal from having its effect, like how atropine blocks the action of acetylcholine. Some drugs go even further and act as inverse agonists, producing the opposite effect of what an agonist would do. And then there are partial agonists, which only partially activate the receptor, producing a smaller effect while also blocking a full agonist from having its maximum effect. All of this comes together under what's called the drug receptor occupation theory. In simple terms, this theory suggests that the more drug molecules bind to receptors, the greater the effect. But here's the twist: just binding isn't always enough. The drug has to cause a change in the receptor to trigger the desired response. That's why we talk about affinity, how well a drug binds to a receptor, and intrinsic activity, how much effect the drug can produce after binding. As we explore the dose-response relationship, we see how the amount of a drug administered affects the body's response. For instance, if you take 500 milligrams of paracetamol, you expect a reduction in fever. That's the response. But if you take more or less than the recommended dose, the response can vary. This is why we use dose-response curves, to study how different doses produce varying effects. There are two types of curves, graded and quantile. Graded curves show how the response increases with the dose, while quantile curves deal with all or none responses, like whether a drug successfully prevents seizures or not. Factors like age, weight, gender, and even the environment can all influence how a person responds to a drug. This is why individualized dosing is so important in medicine. What works for one person might not work the same way for someone else. In conclusion, pharmacodynamics is a complex and fascinating field that underlies our understanding of how drugs work. By understanding the biochemical and physiological effects of drugs on the body, we can develop targeted therapies that are more effective and safer. Thank you for joining me on this journey through the world of pharmacodynamics.